Hello, everybody. This is Dr. Keith Miller, former president of the Pennsylvania Chiropractic Association. And today with us is Dr. Michael Schneider, DC, PhD. And we are going to have a little back and forth to discuss the upcoming and very exciting chiropractic program that will be launched at the University of Pittsburgh starting the fall of 2024. So let me introduce our interviewee. Michael Schneider is a practicing doctor of chiropractic for over 25 years before becoming a full-time academic researcher and postgraduate continuing education speaker and professor at the University of Pitt, and now the first director of the chiropractic program of that university. He received his PhD in rehabilitation science from the University of Pittsburgh and has authored over 100 peer-reviewed publications, mostly in the education and science of chiropractic. Dr. Schneider has a strong record of NIH funding and research from the National Center of Complementary and Integrative Health and the Patient-Centered Outcomes and Research Institute. Over the past 6 years, he has co-led the Pitt Primary Spine Practitioner Certification Program that brings together both physical therapists and chiropractic from across the country, Europe, and even parts of the Middle East to train as first contact providers for patients with spinal problems. Dr. Schneider has received both the Presidential Award and Researcher of the Year Award from the American Chiropractic Association. He has also received the Distinguished Service Award from the American Public Health Association. Let me introduce Dr. Michael Schneider. Thank you for joining us today and going over and asking. We have a lot of members, Dr. Schneider, who are very excited about this program. We at the PCA are very excited, but there's definitely a lot of questions about the meat and potatoes of your program.
Yeah, well, thanks for inviting me. I look forward to answering your questions.
Our first question, which is, what was the inspiration to establishing this chiropractic program within the University of Pittsburgh? And what is your primary goals that you hope to achieve with this pioneering initiative?
Yeah, well, so I can make a very long story as short as possible here. You know, I've been at the University of Pittsburgh over 20 years, both as a student and now as a faculty member. And so I got to know a lot of people here, including the dean of our School of Health and Rehab Sciences, Tony DeLito. In fact, I asked him to come with me to an integrative medicine conference it was almost exactly 10 years ago, May of 2014, where he and I met with the program officer from the National Center for Complementary and Alternative Medicine at that time, who's also a chiropractor, Partop Khalsa. And it was just a dinner conversation like we're doing here. It's like, hey, the NIH program officer said, you guys are doing research at the University of Pittsburgh. Have you ever thought about having a chiropractic program? It's like, no, I really hadn't. And that sparked, a conversation where we said, you know what, we could think this could possibly happen. So we came back to Pittsburgh, started talking about it more seriously, and here we are 10 years later with the program approved. So we have three aspirational goals, I would say, for this program at Pitt. One's educational, right? We want to provide an integrated chiropractic education in a major public university rather than in an isolated standalone chiropractic institution. And we think the interprofessional nature of this education will be something unique for chiropractic in the US. That's the educational goal. The clinical goal is to provide clinical training in interprofessional settings. We will have training in private chiropractic settings, but we also have a very strong presence in the VA system here. And we're also becoming integrated, hopefully very soon, within some federally qualified health centers, which are primary care. So we'd like our students to be training in these interprofessional team-based environments rather than being isolated out in the periphery in private practice only. And then the third goal, aspirational goal, is research. We want to continue to have a strong research agenda to help prove the effectiveness of chiropractic care.
Introduce our other questioner today, the new, as of May 2024, president of the Pennsylvania Chiropractic Association, Dr. Drew Heck.
Hi, nice to meet you, Dr. Schneider. Being in a major university at University of Pittsburgh, what unique advantages do you think this presents for the students and the profession as a whole?
Yeah, it's a great question. I would just cut to the chase and say interprofessional education, right? The resources available at a large university like the University of Pittsburgh bring together many experts from many fields. But before I go a little further with that, I want to explain the structure of the University of Pittsburgh, because a lot of people get confused. They say, oh, Mike, congratulations for the president of a chiropractic college. This is not a college. This is not a school. The University of Pittsburgh is a university that has schools, and we have 6 schools of the health sciences. There's a school of medicine, of course. We have a school of health and rehabilitation sciences, and that's where a lot of the non-physician programs are, including occupational therapy, the physician assistant program, the physical therapy program, and that's where the chiropractic program will be housed within the School of Health and Rehabilitation Sciences. What's really exciting, we say, what's unique about this? Well, as fate would have it, our incoming class will be September of 2025, about a year from now, in a brand new building that the University of Pittsburgh is a 10-story building that's being built specifically for the School of Health and Rehab Sciences programs. So we're going to be the first new program in this brand new building next year. So that facility is actually being designed by the architects for interprofessional education. So we'll be sharing classroom space with other programs, and our students will socialize with students from other healthcare programs, which is really the best way, as we probably know from being in private practice, right? It's all about relationships. So you get to know sometimes more than what you learn in the classroom. So we're very excited. We think our clinical training will be a model for the US, where we're going to train our students in the VA system. As a result of being here at Pittsburgh, I was able to introduce chiropractic services to the Pittsburgh VA about 8 years ago with 1 chiropractor. We now have 8 chiropractors in the Pittsburgh area. We have 5 chiropractors in the Butler VA system and another 5 up in Johnstown, Altoona. So we have almost 20 chiropractors in Western Pennsylvania, all within the VA. And we have a letter of support from the medical director that all 20 of them or 18 of them can be clinical instructors for our students. So this will be a great opportunity for clinical training. And we will be developing a network of private practitioners, which I'll talk about maybe a little bit later.
So there's a little bit of confusion. We're talking about University of Pittsburgh Medical Center. We're talking about University of Pittsburgh. There's also UPMC Insurance. Could you do me a favor so people understand what is the difference? Are they the same? How do they work together? Could you, for everyone listening, give them an idea so they understand how these systems all work and how they talk to each other?
Yeah, that's a great question, Dr. Miller. And I think I'm glad you brought it up, because there's a lot of confusion about these 3 entities. They are separate legal corporations, right? The University of Pittsburgh is a corporation that's essentially in the educational business. UPMC stands for University of Pittsburgh Medical Center. That's a separate corporation that provides medical services. They're in the medical service delivery business. They treat patients. And then the third corporate entity is the UPMC Health Plan, which is an insurance company, right, that provides coverage for medical care. So we have an educational institute, a healthcare delivery institute, and a insurance company. And you would think that there's a lot of crosstalk between these 3. There isn't as much as you would think. There is some crosstalk, but we don't really meet regularly. I have no influence over the health plan. The health plan has no influence over me. So I guess you could say that we're family members that don't always hang out and talk to each other, maybe. It's a good way of putting it.
I understand that. I have some family members I don't talk to either.
With this being the first chiropractic program within a major university system, so what steps have been taken to ensure the curriculum meets the highest standards while also reflecting chiropractic's historical philosophy, principles, and practices that are utilized within the profession?
Yeah, great question. So as you can imagine, at a big public university like University of Pittsburgh, the university has its own academic standards that we have to live up to, right? So we had to meet or exceed some of the university standards, which we did with our curriculum and was approved. We've been approved all the way up to the level of the chancellor. So we've met their expectations. Then we have CCE, right, to deal with. We have our own standards within the chiropractic profession. And then we have middle states accreditation, which is a regional federal agency. So without boring with all the details, we've basically met all of those standards. We've applied for CCE accreditation, which will not formally completely occur until about 2 years out. We're going to place great emphasis on chiropractic technique, which I think has fallen off some of the schools' radars a little bit, or has begun a little bit less intensive. We want to have a very, very strong chiropractic technique curriculum with hands-on instruction, so that our graduates are really good with their hands and excellent adjusters. That's really important to us. At the same time, we want our students to be very astute at musculoskeletal diagnosis, especially. They will have training in internal disorders and differential diagnosis as well. All of our core teaching faculty will be chiropractors. We may use some basic science instructors from some of the other programs here, but our core full-time faculty will all be chiropractors. And we want them to bring a clinical perspective to all the courses, including our basic science courses, which unfortunately in a lot of programs are just rote memorization. We don't want just students to memorize the basic sciences. We want them to be clinically relevant. And we think that chiropractors teaching the basic sciences or co-teaching the basic sciences is the best way for us to bring a clinical perspective to everything that they learn. One great thing about here at the University of Pittsburgh is we have a Center for Teaching and Learning. So all of our core faculty can actually take courses on how to be good instructors and how to write test questions properly, how to assess students. This is something also that's been missing in a lot of our other chiropractic programs, teaching people how to be good teachers.
I know one of the initial problems and challenges that you faced at the University of Pittsburgh to get this program off the ground was that the Pennsylvania chiropractic scope of practice didn't really have a carve out for chiropractic student interns. And the PCA was able to create and pass a bill just a few years ago to allow the delegation and supervision of chiropractic students and student interns in Pennsylvania, like some other states did. And that was the first challenge that I know that the University of Pittsburgh had. Now that we've accomplished that with the PCA's help, what are the other large challenges that you are seeing or foreseeing in the University of Pittsburgh program as you create this new model moving forward?
Yeah, another great question. I think you kind of hit the nail on the head here. The major problem here was, 6 years ago or so, with making sure that we changed the scope of practice. And so thanks to the PCA working with two lobbyists here from the University of Pittsburgh together, that was able to get changed. Now that that's changed, frankly, there's not a lot in the way here. In fact, I've been pleasantly surprised that we've had no opposition from anybody in the medical school, the nursing school, physical therapy, you name it. We have not had any opposition. In fact, just the opposite. I've had very enthusiastic, and I have written letters of support from the chairman of the Department of Neurosurgery, orthopedic surgery, physical medicine, rehab. I mean, everybody's on board with this. The chancellor of the university, I've been told, I've not met her personally, but I've been told that she's very enthusiastic about this and understands the importance of being the first in the United States to offer a chiropractic program. So I think times have changed, right? We're here in 2024, right? It's not 1924 anymore. I think the time has come for chiropractic to be recognized for what it is and there's very little opposition.
As part of that scope of practice change that happened, that I believe it was passed in what, like 2019? I think that bill was passed. The PCA is updating the scope of practice across the board, and that is a project that we're undertaking now. Pennsylvania's scope has been pretty behind the ball, getting caught up to some of our other states and keeping up with the changes in the profession. So we're really looking forward to that being the first of the scope updates and working with the University of Pittsburgh to update the scope of practice. So all of your graduates will be able to enter Pennsylvania practicing to the full knowledge and education that your new program will be offering for all of them. So thank you for that. And thank you for the support. And we look forward to more collaborative efforts with you guys.
It's really encouraging to hear that, the other healthcare professions within the university system are, on board with this. That's exciting as somebody that, has always had the goal of wanting to have an integrated practice like that. So what's the plan for the program length and how is that structured?
Yeah, that's a pretty straightforward question. University of Pittsburgh has semesters. It's a little confusing because we have a summer semester. So essentially we have 3 semesters, which I would call trimesters. But the reason they call them semesters is that, for example, if you were getting an undergraduate degree in English, you would do a fall semester or spring semester, you have the summers off. The chiropractic program will go 8 semesters, so it'll be just under 3 years, right? So fall, spring, summer, fall, spring, summer, fall, spring, graduate.
Oh, that's a much faster program than a lot of the other schools have out there, existing trimester and quarter systems out there. So I imagine for some people who want to graduate from undergrad and get out working quicker, a program like that would be desirable just for the speed of which you're going to move through by calendar cycles.
And that was the intent of this. The trend in the United States in healthcare professions is to try to condense and shorten the programs for the reason you just mentioned, to get out sooner, but also to save some money off the tuition costs. Our medical school, believe it or not, just announced this last month that if you enter medical school declaring that you want to go into primary care medicine, they will graduate you in 3 years instead of 4 and get you into a residency sooner. That's a 25% discount on getting a medical doctor degree, right?
Wow.
Why are they doing that? Because there's a primary care shortage in the United States, which, by the way, that's grounds for another discussion. Chiropractors can help fill this gap, especially with spine and musculoskeletal care. But if the medical school is shortening their program, why can't we do that?
I know a lot of people watching this that either have children or have patients that have expressed interest in becoming a chiropractor. Will be really excited to know that as Pennsylvania residents, they'll be able to go to a school in Pennsylvania, get out quicker, and come right back to the Commonwealth from which they live. So that's a really exciting announcement from your program. One of the things you talked about during that is the cost. So one of the questions I know a lot of people are probably going to have is, will the university have postgraduate financial aid? Are you going to have sponsorships and scholarships in the program? And will there be any types of special opportunities for either underprivileged students or people of low financial means in order to join this pathway in your program?
Yeah, that's a great question. Again, this is the University of Pittsburgh. It's a big institution. So our Doctor of Chiropractic program will not have its own separate and distinct admissions and registrar, right? We're going to work on the university level. So all students in the School of Health and Rehab Sciences at the graduate level have the opportunity to apply for scholarships and financial award opportunities. There are some there offered by the university. Others are school-wide. Some are program specific. This is a brand new program. We don't have any students yet, right? So we're working on trying to develop some chiropractic specific scholarship funds. We don't have any at this time. Current students, new incoming students, can search our scholarship database on our university website. There's a Pitt Fund $me. You can look at opportunities there, any students that are coming in. We also have an Office of Financial Wellness at the University of Pittsburgh that will sit down with students, talk about their financial skills, how to take control of their finances, apply for scholarships, apply for funding. They are a great resource. So again, one of the big benefits of a big university, there's big assistance available for financial aid.
I know you touched a little bit on how there's some unique opportunities within the VA networks, but what other innovative approaches or methodologies will be employed in the teaching and training of future chiropractors within this new program?
A lot. a lot of innovation. So again, a big institution like this, this is where we can start to talk to one of our family members, UPMC. So for example, one of the things we want to do is in every one of these 8 semesters is have clinical training opportunities for the students. I mean, I'm a clinician at heart. I did this for over 25 years before I switched over to an academic position. You know, if it's not clinically relevant, I don't think it's good education. And so right away, we like our students to be seeing some of the disorders, for example, that we learn about in our pathology classes, right? We have a rehab institute and a rehab hospital here where we plan to do this. Our students go in there, see patients who've had strokes, multiple sclerosis, Parkinson's disease, all these really severe neurological disorders that we read about in the textbook. We want to see those patients and be able to see what a positive Babinski looks like, right? What does cogwheel rigidity and spasticity look like? All these neurological signs and symptoms that we read about in a textbook, we want them to see them, right? We want them to observe spine surgery and orthopedic surgery, hip replacements, knee replacements. We want them to know what those surgeries actually look like. So when they talk to their patients about them, it's not just from a textbook. So we will rely on some of our partners in UPMC for those clinical rotations in the earlier semesters. But then we want to get students at the chiropractic clinics watching chiropractors treat chiropractic patients. And we can do that with our network of private practitioners, the VA, and in our federally qualified health centers. The other thing that's innovative, we just talked about it, 8 semesters. You're done in less than 3 years with hopefully less tuition burden, and you'll have a better return on your investment. Our faculty are going to be all chiropractors who are taught how to be good teachers. And their model teaching is going to be different than what we had when I was in chiropractic school, where you had the sage on stage professing to you. We're not using that. That's an old school model of teaching. We want to use more small group discussions, interactive discussion groups, more of a problem-based learning type model, grand rounds. Again, everything clinically relevant, everything taught from a chiropractic perspective. We're planning on using force sensing technology in our technique classes. So students learn how to control their manual forces using 21st century technology instead of practicing on each other, saying, how did that feel? Oh, you hurt me. Oh, I guess I used too much force. Why can't we practice using force sensing technology in mannequins and then assess the students to say, okay, now you're ready to work on one of your colleagues. And last but not least, the interprofessional nature of our courses will be phenomenal. I'll give you one great example. I spoke to the director. We have a undergraduate program in nutrition science here at the University of Pittsburgh. Those instructors said, we'd love it. If you want us to teach some basic nutrition courses for you or biochemistry of nutrition, we can do that, right? So why wouldn't I use them to help teach some courses in nutrition? Of course, I'll have a chiropractor co-teach with them, but this is their expertise. We have a shared cadaver lab here as well with courses in anatomy that are profession agnostic. Why do we have to have a separate anatomy class for chiropractors than, for example, the physician assistance program? We can have those courses together and share the cadaver lab, again, with a chiropractor overseeing it. So I could go on and on, but those are just some of the highlights of what I think are very innovative about our program.
That sounds really exciting, and I'm going to ask a question that kind of delves in along that. So, one of the things that you keep going over is the integration, and how it's not going to be a standalone chiropractic university or chiropractic college, and it's going to be kind of spread out a little bit through and give more ability for chiropractors to see what else is going on out there. So, in addition to that, how do you specifically are going to, because you have access to the medical school, the physical therapy school, the public health school, you mentioned the nutrition program, how are you going to create like interdisciplinary learning and training? So as these people go out, not only will the chiropractors already be used to co-working with those people, but more importantly, as I see it, I think it gives those professions a really good insight into what we do, just as much the other way around, which I think really is one of the nice new things that happens out there. So how is your program going to create that interprofessional puzzle and network and mesh? And how do you foresee chiropractic students from your program working with those people in the program that you've established?
The best response to that is this is a two-way street, right? We're talking about how I can use people from other departments to teach in our basic sciences, but the opposite is true. And that's already happened. In the 15 years I've been at Pitt, I've been a guest lecturer in the medical school, physical therapy department, physician assistant program, pain medicine. They've asked me, and as I speak with them and get to meet these people, right, it gives them a different impression of chiropractic that maybe is different from what their preconceived notions were going to be. So as we start this program, I've already been asked by other programs, hey, could some of your instructors, can we borrow them to teach some of our classes, right? So that two-way street is where the true interprofessional education occurs. And like I mentioned, in this brand new building, the architects actually met with all the department chairs, including me, to say, okay, what other professions do you see yourself blending with? Because we want to co-locate your classrooms. So the physical space will actually be built for this as well.
Yeah, that's excellent to hear. I know, everything that you're saying is making me want to go back to school, but I know it's a little too late for me. I know all students, they're required to get a certain number of hours on the on-campus clinics and doing externships. So like with this unique situation that we have with the integration with all these other professionals and majors within the university, there's certain CCE accreditation standards. So like the way that it was set up for me when I went to school, we would start in student clinic, and then we would do an on-campus clinic, and then you'd have the opportunity for preceptorship programs. Is that going to be similar pathway at University of Pittsburgh?
Yeah, it will be different. So we're breaking that mold, right? The traditional chiropractic educational mold has been have a student clinic, right, where students treat students and family, and then have a outpatient clinic, chiropractic clinic, and then have preceptorship. That's the traditional model. We're not going to follow that model at all, right? Our model is going to be that they sort of immediately go into mini preceptorships, right? So when they start training with other chiropractors, they're observing chiropractors, they're maybe doing an exam, and then they're going to be allowed to adjust and treat. So we typically call that a preceptorship, right? And that's usually in the last one or two semesters or trimesters of a chiropractic program. Probably by about our third semester, we're going to have chiropractic students out in chiropractic clinics. So for example, you're mentioning in the outpatient world. By the way, when we finish up today, I'm going to give a link. If you're a chiropractor and you're interested in being a preceptor site for us, we now have a link for you to go onto our site and give us your information, and we can contact you about the specifics if you really want to do that. We expect to have a lot of private practice chiropractors wanting to be preceptor sites for us, but we will not have a student clinic or a outpatient chiropractic clinic. Our idea is that all the training would occur, other than private chiropractic practices, All the other training would be in the VA or in primary care settings, where the chiropractor would be acting as the primary first contact provider for spine and musculoskeletal conditions.
It sounds exciting because I know, and a lot of us older docs, and you probably yourself, Dr. Schneider, it was really rough in outpatient clinic. You had to go find your patients. You had to go drag people that you met off the street in. I was at Life. I love Life. I'm not going to say anything bad about the university, but I remember how hard it was, especially to get people to drive to the university, to park their car at the university, to have to come into the clinic. From the time they pulled onto the street to come to the outpatient clinic, it could be an hour and a half for them to get their adjustment done. And it made it very, very difficult for a lot of us to get those required minimum number of one-on-one patient visits in order to get your requirement for the CCE. So,
and yes, I remember those days from Palmer. I had the same. I went to Palmer Davenport, and we had the same issue. And I don't think it's really fair to put the burden on students to find patients. There's something wrong with that, right? We have the opposite. If you think about the VA system, it's a great example, right? I told you 8 years ago we started with one chiropractor here. Well, within a couple months, he's has a 60-day wait for new patients. So they hire a second, right? And so now we're up to 8 chiropractors, and they still need more because the demand is so great for chiropractic services. There's no problem with new patients. The problem is there's too many new patients and too few chiropractors to see them. You talk about flipping 180 degrees from when we went to chiropractic school. It's amazing the difference.
Just in the VA system alone, and the PCA was part of the ACA effort to pass the federal bill that got chiropractors into the military and the VA system and into the TRICARE programs and stuff. And one of the statistics that was quite interesting with the VA system was that the #1 reason an enlisted member of the military and the #1 reason a not active military member seeks care in the VA system is back pain. Back pain, followed by other musculoskeletal pain second, was the #1, #2, and #3 reason that people went to the VA seeking care. So it's been wonderful to see how chiropractic has been able to really get a foothold quickly because the demand was always there. They just didn't have the tools, and chiropractors are allowing one more piece of that Swiss Army knife to help all of our men and women of our military services. And it's going to be really great when the ACA gets the expansion into Medicare and creates even more opportunities for both patients and chiropractors to treat that elderly and disabled population. And further where I'm going with this, research. Research has been one of those things that really has allowed chiropractors to kind of push out into the larger profession. I imagine now that we're going to be creating this School of Chiropractic within the University of Pittsburgh, and University of Pittsburgh being a very large research institution, this is going to allow for a much larger access to chiropractic education and research opportunities. So could you give us some kind of idea of how your new program and the University of Pittsburgh will allow for greater amounts of chiropractic research to help the profession?
Sure. I mean, that's my thing, right? For the past 15 years, I've been full-time research professor here at the University of Pittsburgh. Just to tout the University of Pittsburgh a little bit here, you may not realize, our PCA members may undervalue how strong of a research institution University of Pittsburgh is. So University of Pittsburgh is classified by the American Council on Education as an R1 university. R1 universities are the top research-intensive institutions that grant a high number of PhDs and doctorate level degrees. Pitt has consistently, since I've been here, been in the top 10 in NIH funding. We've been as high as #3. I think this year we're #7, but we're in the top 10 institutions in the US with funding. For example, for the past 3 years, I looked this up, Pitt's gotten over $650 million per year just in NIH funding. That's about $2 billion. I mean, these are huge numbers, right? And so when you're in an institution with that kind of clout, you know, it's like we tell our kids sometimes, life's not fair, right? You know, the rich get richer and the poor get poorer. Well, big institutions like Pittsburgh continue to get rich. We continue to get NIH funding because when we submit a grant, those reviewers can't help but notice it came from the University of Pittsburgh. They know we can get stuff done, and we have a high funding track record. So our chiropractic program will introduce evidence-based practice as part of our curriculum. Let's face it, not everybody aspires to be a researcher. Honestly, if we get one student per year that wants to go on to get a PhD and do research, we'll find those students and we'll have the opportunities to groom them to be the next generation, you know, of chiropractic researchers. We will have research methods, kind of a little bit of a thread through our curriculum, but not because we want to create researchers, but we want them to be able to appreciate and be good consumers of research. We definitely plan to continue many lines of research. For example, right now, I have a researcher from Canadian Memorial Chiropractic College here for 6 months, who I brought down as a visiting scholar, who's doing kinematics research in cervical spine. We're going to image cervical spine adjustments real time using this technology. So that kind of basic science research we can do here. We have clinical trials going on involving chiropractic treatment for conditions like lumbar spinal stenosis and low back pain. So we have clinical trials that we can do. We also have dissemination and implementation grants that we're working on. Right now, we have a pilot, for example, where we're going to train physician assistants to make early referrals to chiropractors rather than trying to manage the patients themselves. So we have all these different types of research. We have the resources here to train the next generation. And we do have a PhD program for those ambitious people who want to go on and become chiropractic researchers.
Like the students that are going to be coming in, what qualities or attributes do you believe are going to be essential for, you know, aspiring chiropractors and chiropractic students? And how do you think the program's going to cultivate these qualities as they grow in their careers?
Well, that's a good segue to me making my first little pitch here. August 1st, our admissions open. So if you know of any students who want to apply, August 1st, we're opening up for next year, for next fall. And so we're going to be, it's a timely question because, you know, we have to develop sort of a scoring rubric here as we you know, bring students in. Like what, you know, we've got Drew and Keith here in front of us. You know, they both have the same grade point average, but why would I pick Keith over Andrew or vice versa, right? And so we think it's personality issues, right? I think like all healthcare professions, the most important attribute is you got to want to have a passion for helping people, right? Are you a people person? Do you really want to help people? Are you going into this because you want to heal people or because you just want to make money, right? We don't want people getting into this just because it's a business for them, that they have to have a passion for what they're doing. And hopefully not just helping people, but helping people with chiropractic. Those students who've had, you know, a chiropractic background or been exposed to chiropractic, do I have to? No, not necessarily. But, you know, some of the basics that that attracted all of us to chiropractic, right? That it's a natural healthcare profession, you know, without drugs and surgery. You use your hands to help people. When people start articulating those attributes, that's what we're looking for. And frankly, we want people who are good with their hands. This is something, you know, we tend to skirt around in a lot of discussions about chiropractic, right? That you get really smart students. This requires manual dexterity and skill. And so we're looking for people who have good hands-on skills and that can be developed, right? So again, does somebody have to come in and be able to, somebody told me we should give a juggling test, right? That if you can juggle, you've got good manual dexterity. That's who we should let in, people who can juggle. Look, that aside, all of these factors, in the University of Pittsburgh, we are now expected to follow a holistic admissions policy, which is kind of interesting, right? That we're just not going to take the students with the highest GPAs. We want smart students, but we want well-rounded students, and we're going to look at the whole person in our admissions policy.
I think if the admission requirement for me was juggling, I don't know if I'd be a chiropractor today.
Well, it's holistic. We wouldn't hold that against you. That would just be one attribute.
Now that chiropractic is entering a major university, I imagine that perception of chiropractic is going to start to change. It's going to start to change not only at the university level and at the teaching level, but in the broader medical and academic environment, and maybe even to how patients perceive us. So how do you personally perceive this perception change, and how the University of Pittsburgh will be a part of that?
Well, I've already seen that perception change in the years I've been at the university, being involved with research, right? Because research is also an interprofessional team sport, if you will, right? So I interact with, medical doctors, psychologists, physical therapists, whatever. And when they first meet me, I'm coming in as a researcher, they don't judge me, right? And then when they find out that I'm a chiropractor, sometimes you could see, well, the perceptions there, it changes very, very quickly. Because once people get to know who you are, right? There's that old saying, who you are speaks so loudly, I can't hear what you're saying, right? So I've already made that change in perception personally here. But now that the program's been approved, the perception's already changed. So for example, I met the new dean of our medical school, who's very open to this. In fact, when I met him, I was wondering what his perception was. He said, the first thing he said to me, he read my bio sketch and bio. He saw all the NIH grants that I've been a PI on and all the money I've brought to the University of Pittsburgh. And he's like, wow, you've done a lot of research, as a chiropractor, this is very commendable. And, your profession used to be considered sort of alternative, but I consider it to be integrative. And I'm really happy that this program's starting here, right? That's the dean of our medical school. The chancellor of the university is also very stoked that we're the first university in the United States to offer a chiropractic program. He sees that as sort of a badge of honor. I've done many media interviews already with Pittsburgh Post-Gazette and some local media, nothing but positive comments and perceptions. I think it will only continue. So, Reed Phillips is the one who said to say this quote, "The rising tide lifts all boats," right? So the perception that this program is going to bring to the media is going to have a spillover effect, I believe, to every chiropractor in the Commonwealth of Pennsylvania. The US, even internationally, I'm getting emails from people in Australia and in Europe and Brazil hearing about this program in the US. So it's making some ripples, and I believe we'll have mostly positive perceptions. I've not heard any negative ones. I'm still waiting for that to come. I'm sure it will someday, but it hasn't happened yet.
So I know you touched on this a little bit with creating a new model, but anything else to add on that?
Well, I think Dr. Miller brought this up a little bit a moment ago, right? That we don't have a chiropractic program in the Commonwealth of Pennsylvania. We got 2 programs up in New York, got Bridgeport. We don't have anything in New Jersey, Pennsylvania, Maryland, West Virginia, Ohio, right? So we're going to become a regional hub for chiropractic. And the University of Pittsburgh has done market analysis, right? Most of the students at the University of Pittsburgh are from the states I just mentioned to you. So I think we're going to get a lot of local, when I say local, within the contiguous states, of local students who, just as Dr. Miller stated, will come here, get their degrees, and stay local. And so I think it will have a broad effect on chiropractic utilization in this northeastern part of the country. I do see us getting some international students as well. I'll be curious to see how many we get. I've already had several Canadian students express interest in coming down to Pittsburgh. We forget how close, right? Toronto, which is the largest city in Canada, is a 5.5-hour drive from Pittsburgh. And we have a very good relationship with Canadian Memorial. So I guess my answer is we'll just have to wait and see. I got to get the program started first, get some students in here, and I guess we'll see where it goes.
Yeah. How do you anticipate the program that you guys are creating is going to kind of directly affect both Pennsylvania chiropractors in current practice and the communities that we're all serving, and how it's going to also then spread over into maybe healthcare policy within the Commonwealth?
Yeah, boy, that's more than one question. Well, let's start. Maybe I can just answer it like this. Here's what I'm going to envision what's going to start happening. We start having our program next year. Students will be coming in as preceptors into chiropractors' practices, right? So it's essentially free labor. Like, I can't put it any other way, right? You're going to have students that are very well qualified. They're going to be good adjusters. They're going to have a very strong knowledge of rehab, right? So, for example, in our state right now, because of the delegation issue, a chiropractic student can be your rehab provider. So the preceptors that come in can be used to help chiropractors build their practices. And I think as we see more public media perception, if it is going, the rising tide will lift all boats. There'll be more demand for chiropractic services. These preceptors could then be, not only are they free labor, for lack of a better term, it's also your interview process. You get to see how this chiropractor works. If you like the person when they're a preceptor, maybe you hire them on as an associate doctor and help build your practice with very qualified people who are going to hit the ground running, because these are people that have had strong clinical training and know what they're doing, right? So the learning curve will not be there. They'll be hit the ground running right away. So what effect will that have on private practices? I think it'll have a beneficial effect. It'll grow practices and create a pool of highly qualified preceptors and associate doctors.
Well, I'm out of questions right now, and I think I learned a lot about your program, the admissions process, the education process, the length of the program, the financials, how it's going to impact both research nationally, how it's going to affect people in the Commonwealth locally. I think it's going to be a great economic driver for Pennsylvania and the Commonwealth and for our profession locally. So thank you for answering all of our questions. Dr. Heck, do you have any questions left?
Just before we close, my generation, they like to call this the shameless plug, but anything that you'd like to plug for the university?
Well, yeah, two things. One is that admissions open August 1st. If you just go to the University of Pittsburgh and type chiropractic, you'll come to our chiropractic homepage. And there's a whole bunch of, I put it in the chat, shrs.pitt.edu/chiropractic. That brings you to a chiropractic webpage. Everything's on there for if you're a student. It has links to the admissions process. And if you're a private practice chiropractor, like I said earlier in the podcast, if you're interested in applying to potentially be an adjunct faculty or have preceptors, there's a tab at the top that says community providers on that homepage. To click on that community providers link, it brings you to just basically a simple, give us your name and information and we'll contact you. So I'm looking forward to having students apply and having private practitioners apply to help us as adjunct faculty. I want to thank the PCA for putting this on. I think it's really important to get the word out. I've been a member of PCA since 1990, which is when I moved to Pittsburgh from northern New Jersey. I grew up in Jersey City, lost most of my accent over the years, but the PCA has done a great job. And so thank you very much for spreading the word about this really important program.
As a North Jersey guy myself, practicing in the Commonwealth, I understand why you left North Jersey and came to Pennsylvania, if nothing else, to escape the property taxes.
Well, I love Pittsburgh. I love the University of Pittsburgh. I think we have a great program and a great city. So I'm looking forward to continuing our relationship with the PCA.
We at the PCA are extremely excited about having this program here. We think it's going to add a lot of credibility and notoriety to chiropractic in the Commonwealth. I think it's going to make the average patient more informed. One of the largest things that's come out of a lot of the education and research. In fact, it's one of the things that the National Academy of Science and Medicine conferences that was spoke about not long ago when they did data regression was the biggest problem that they had with patients seeking chiropractic care was that the broader profession is just unaware of what we do. and we're not getting enough referrals from the broader profession into chiropractic. So I think having your program in the Commonwealth is not only going to be great for creating the next generation of local chiropractors, but I think it's going to actually influence more patients in Pennsylvania to seek chiropractic and non-opioid therapy first for musculoskeletal conditions. So at the PCA and as a member and as a former leader, I'm really excited for what it's going to do for the profession as a whole. So we look forward to, at the PCA, working with the University of Pittsburgh, you, Dr. Schneider, and we're really looking forward to the first crop of students coming into all of our PCA private clinics and being able to be the next generation builders and mentors for all of those students. So thank you.
Thank you for all the contributions that you made to the profession, and we look forward to working with you in the future as well.
Likewise, thank you.
Thank you, everyone, for being here, everyone who's watching this program. If you have students that are excited and they're in their either high school or in their undergrad phase of their education, they're interested about maybe being a chiropractor, you can use the links provided below with this video to find out more about the University of Pittsburgh's program. After this is over, we're going to take the painstaking process of kind of condensing down some of these answers and putting it into a nice text version. We'll also, hopefully, as you're watching this, we've already done that, and it will be included as a PDF with this video of summaries of some of the answers here to make it easier if you need to get that data for other use. Thank you for watching this. Please take this video and send it to your peers who might want to be preceptor sites. Please use this video and send it out to prospective students. If you have medical providers in your community who want to know more about chiropractic and chiropractic education, this is, once again, a really great video that you can send out to those other medical professionals, either PTs, OTs, MDs, DOs, and XYZs, who might want to know more about chiropractic and chiropractic education, research, and the opportunities out there. Thank you for watching, and we look forward to more and innovative things that the PCA is doing. And more things that we could do with more collaboration with the University of Pittsburgh and the program.